As suggested by Sir William Osler, the mouth is the mirror to the body. So when you go to any general physician, they usually examine for the pallor. We have pickle criteria, right? Pallor, icterus, cyanosis, clubbing, and pedal edema and lymphadenopathy. About that, pallor is one of the the signs which we observe in the dorsal aspect of the tongue. So it will give out the other possibilities, other conditions, other systemic manifestations which we have. So it does make sense, right? The mouth is the mirror of the entire body. So the upcoming slides, I have gathered all the images which I recorded from the patients attending the Department of Oral Medicine and Radiology during the period of 2022 Jan to 2024 June in Chennai. So it is all real case-based images. All the rare morphology, I mean anomalies, will not. I was unable to entitle it. So, but then I'll mention a few gist of it also. So this classification I adapted from the Burkitt's recent edition. So how they have coined it that it's the first one is congenital and developmental disorders. The second one is OPMDs, all premalignant lesions. Third is ulcerative conditions. Fourth, malignant tumors. Deep appellative disorders, and local tongue conditions, including the ventral and dorsal aspect, neurological conditions, pigmentation of tongue, benign tumors. You may wonder why I didn't get into the basics, because we should be very familiar about the anatomy of the tongue, its function. It is just a muscular organ. It helps us in deglutition, articulation, mastication, not no, and oral cleansing also, and it does helps in sensory perception. So I don't want to get into the basics of the tongue, its nerve supply, arterial supply, but then we should understand a little about the other no, anatomical parts which we may get confused with the pathologies. I will explain then and there with the pictures itself. But then